Hi, everybody. Again, I'm Michael Barasch. I'm joined here this evening by my partners, Dana Cohn, Dom Penson, Lee London, and our associate, James Steiner. And we're very honored this evening that Dr. Daniel Sterman of NYU Langone is here. And Dr. Sturman, thank you so much for joining us this evening.
It is my pleasure. Thank you so much, Michael, for having me.
Well, it's us who thank you. Matt, let's start by showing a short little video to set the table, and then we'll come back and we'll begin.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
Dr. Sterman, you are a pulmonologist, and since November is Lung Cancer and COPD Awareness Month, we thought it appropriate to bring on someone of your stature this evening. First of all, I know you're at NYU Langone, and that is a wonderful hospital on the east side of New York. You're actually director of the Division of Pulmonary Critical Care and Sleep Medicine at NYU. I'm turning it over to you to tell us about not just lung cancer, but since the 9/11 community is so affected by interstitial lung disease, asthma, reactive airways disease, pulmonary fibrosis, I'm going to let you speak about all that tonight.
Thank you, Michael. And thank you all for listening today and for being part of this presentation. This is a very important month for myself and for pulmonologists around the country, because 2 of the diseases that are most prevalent and cause the most morbidity and mortality in our field, lung cancer and COPD, are represented in awareness months in November. So it's extremely important that we get out the word about both lung cancer and COPD, about early identification and treatment for both of these diseases, which are extremely important. I have to admit a bias, which is that my entire career, personal career, but prior to coming to NYU and since coming to NYU, has been focused on developing new treatments for lung cancer. And so my brief presentation I will be giving you will be lung cancer focused, but I will be mentioning some other lung diseases, and glad to discuss and take any questions if we have an ability to take questions regarding other lung diseases which are equal to lung cancer in terms of their effect upon a patient's survival. So let's just go to the slides real quickly, and we'll take it from there. Once again, my name is Dan Sturman. I am the Director of Pulmonary Critical Care and Sleep Medicine at NYU, and I want to give you a few minutes of an update on lung cancer in 2020 with a focus on screening and treatment. So why do we care about lung cancer? It is the #1 cause of cancer death in the United States. It is a major cause of cancer death worldwide. Unfortunately, still in 2020, the majority of patients present in advanced stages, and these patients present with symptoms. And typically when you present with symptoms in advanced stages of lung cancer, it becomes a very difficult disease to cure. The advantage is that lung cancer screening has been approved in the United States for almost a decade now, and we hope this will allow us to diagnose patients at much earlier stages and improve the cure rates. And what you can see here are, as of 2017, the percentages of various cancers that occur among men and women in the United States. And what you'll see is that lung cancer is the second most common cancer among both men and women, but among both men and women, it is the #1 cancer killer. So more men have prostate cancer than lung cancer, and more women have breast cancer than lung cancer, but many more men and women die from lung cancer than either of those other two cancers put together. There are, however, other factors beyond smoking that lead to the development of lung cancer. There's environmental tobacco, so-called secondhand smoke, air pollution, biomass exposure, cooking fires worldwide are increasing rates of lung cancer in places where cigarette smoking is not very common. This is especially true in places like India and China and Southeast Asia. In the Northeast, radon exposure is significantly related to lung cancer, asbestos exposure. And we do know, for example, that there was a significant amount of asbestos in World Trade Center dust, and we don't yet know whether that exposure is going to lead to cancers down the road. It certainly may be doing that already. Industrial products like arsenic and nickel, and then underlying lung diseases. And this is where we talk about other diseases that can be important in lung disease patients. COPD is the 3rd leading cause of death in the United States after heart disease and cancer. And idiopathic pulmonary fibrosis and other fibrosing lung disease are equally important. And the survival for the pulmonary fibrosis diseases, especially idiopathic pulmonary fibrosis, is near that of lung cancer in terms of 5-year survival. So who should be screened? Well, according to the National Lung Screening Trial results and the National Comprehensive Care Network and the U.S. Preventative Services Task Force, if you're between the ages of 55 and 77, if you currently smoke or quit within the last 15 years, and you've smoked 30 pack years, that is 2 packs a day for 15 years or a pack a day for 30 years, whatever you've added up to, if you've done this amount of smoking, then you should be screened. And this may well change. There are guidelines that may in the next few months change this to 20 pack years and to 50 years of age to be able to capture more patients who might benefit from lung cancer screening. And so here at NYU, we've built what we believe is a robust multidisciplinary lung cancer program. This program consists of pulmonary medicine specialists, thoracic surgeons, medical oncologists, radiation oncologists, and it interdigitates with pathologists, radiologists, our colleagues in population health, and perhaps unrecognized but very important, environmental health. We're very focused on the environmental factors that may cause lung cancer, and we are focused on those individuals who may be exposed to toxins in the environment that need to be screened, even if they don't meet the criteria on the basis of cigarette smoking. And we hope that together, all of these groups working together will help conquer lung cancer. I want to thank you for this time to be able to present a little bit about the advances in lung cancer during Lung Cancer Awareness Month, but it's also COPD Awareness Month. And I'm happy to talk over the next few minutes about other lung diseases and their impact upon patients in the New York City region. Thank you very
Dr.
much.
Sturman, thank you so much. I asked you to do the impossible and you did it. I asked you to give a summary of everything in 12 minutes and wow, you did. Thank you. I have a couple of follow-up questions since, as you brightly pointed out, this isn't just about lung cancer this month, it's about all pulmonary illnesses. Look, we are in I wouldn't say we're in the middle of a pandemic, but it certainly feels that way. We're certainly now experiencing a second major wave of COVID-19. Can you tell us what the effect of cigarette smoking, if any, has on someone's risk of becoming a victim of COVID?
Sure. I would say that still remains somewhat controversial, honestly. We do know, for example, that patients with chronic obstructive pulmonary disease, COPD, have an increased risk both of developing COVID-19 and increased risk of having a more severe outcome if you get sick with COVID-19. We do know that COPD itself is often associated with cigarette smoking. Worldwide, actually, it's environmental factors, air pollution, other toxins that people breathe that cause COPD in at least for the frequency of cigarette smoke and maybe increasing more greatly as cigarette smoking decreases. Independent studies have not necessarily shown that cigarette smoking in the absence of lung disease significantly increases the risk of COVID-19. I think that's important. That's not to say I advocate for cigarette smoking. It's just that we just don't know that if you're a smoker and you don't have lung damage, that your risk of having a severe COVID-19 is increased.
There is a distinction between eligibility for the World Trade Center Health Program and eligibility for the Victim Compensation Fund. There are two distinct areas. One is the blue area that you see on the screen for the health program, which encompasses actually some of Western Brooklyn. And then there's the Victim Compensation Fund, which, as you can see from a number of the most common businesses where we represent clients, is in Lower Manhattan, and it includes the Fresh Kills landfill, the morgues, the barges that took the debris to the Fresh Kills landfill. And I just want people to know that there is this distinction. Next slide, please. Great. Lee, would you please take us through some of the most common illnesses that have been presumptively linked by NIH to the World Trade Center toxic exposure?
Early detection is key. So that's why we also have to promote, you must go for your screening exams. The one thing that COVID has taught me is that people will push off their skin cancer exams. They will push off their prostate cancer exams, their breast cancer exams. We want to encourage everybody not to push these exams off and to go in and get checked out, because early detection is key. And as Michael said, I'm going to mention presumption many times, because I always get questions from my clients and people that say, oh, I smoked cigarettes. My lung cancer is not caused by 9/11. It was caused by my cigarette smoking. And it's the presumption that it's like throwing a match on gasoline. You have to get the information, and just because you smoked cigarettes does not mean you would have gotten lung cancer, a definite. So if you were in the zone, you don't need to prove the causation between your cancer and your toxins. If you were in ground zero zone and you were there for the requisite amount of time, your cancer is presumed linked to your 9/11 exposure. So just like
I want to interrupt you just for a second, because you said something very important about pushing off exams. I understand that many of you who are our clients are reluctant to go out for an annual exam. We did a webinar last month for Breast Cancer Awareness Month, and the doctor pleaded with our audience, do not put off your annual mammogram. He said there are going to be tens of thousands of additional and unnecessary breast cancers, prostate cancers, and skin cancers because people aren't going for their annual exams. So I can't, I mean, I'm glad you said it, Lee, but it needed to be reinforced.
There are two types of COPD that is covered by the Victim Compensation Fund and the World Trade Center Health Program. It is exacerbated COPD and new onset. And you don't need to prove any latency to prove that it happened 5 years after your exposure. COPD is covered if it was exacerbated by your 9/11 exposure or if you have new onset. So that's why we encourage everybody to join the World Trade Center Health Program and make sure you are going for your daily checkups, because it is so important to have the health program, have the research on everybody in the 9/11 community. And just like the presumption, you know, I get calls every day. My family has breast cancer. My family has prostate cancer in their family. No, if you were in the zone, these cancers were covered, and these conditions, many of them are still being added today. And one reason why I push everybody, if you had 9/11 exposure, to join the World Trade Center Health Program, because they're always looking to add new conditions to the fund. Cancers were not covered up until 2013. And you saw the doctor talk about the survival rates of lung cancer and have they been better throughout the years. The last 3 years, we've seen it double and increase. So what I worry about are the retirees that left, that moved out of state, and then could have been diagnosed with these horrible cancers and then passed away, and their families don't know they can make a claim.
Doctor, I want to ask you a follow-up question. I see the fifth pulmonary non-cancer illness is sleep apnea. We have seen so many of our clients diagnosed with obstructive sleep apnea, and the health program will recognize it as a 9/11 illness if there's an underlying pulmonary or sinus condition. Can you explain the link between sleep apnea and all these respiratory illnesses?
Sure. I mean, sleep apnea is, for those who are not aware, it's not limited to patients who are significantly overweight, though we tend to think that that's the case. It has to do with the fact that when we're awake, speaking, talking, walking around during the daytime, that we have a certain amount of muscle tone in our upper airway, and it keeps our upper airway open. And that when we lie down at nighttime, we lose some of that tone. And some patients lack enough tone so that their airway collapses and they can't not get enough oxygen into their bloodstream or get rid of enough carbon dioxide, and they actually stop breathing for periods of time. This can be caused also by irritation and inflammation of the back of the throat. And so there are people who they're of normal weight, normal body habitus, and yet they have this obstruction when they sleep. And so breathing in the toxins, even from many years ago, can cause chronic inflammation of those areas in what's called the pharynx, the back of the throat, that can lead to sleep apnea.
And I'll tell you that one of the reasons we ask all of our clients to write an impact statement is because the Victim Compensation Fund looks at everybody as an individual. You might have mild COPD, or you might have mild obstructive lung disease, and someone else will tell me, Michael, I can't keep my eyes open in the middle of the day because I had a horrible night's sleep the evening before. They don't realize that there are treatments that can really improve the quality of your life, but not everybody can benefit from those treatments. So please, I urge you, speak to a pulmonologist, or if you're already in the World Trade Center Health Program, ask them about the treatments for obstructive sleep apnea. There are deadlines. I just want to generally quickly go through this. The most important thing is the one you see in the middle, which is in red. The special master did a wonderful thing for the 9/11 community. The prior rule was there was a strict 2-year deadline to register if your loved one passed away from a 9/11 illness or cancer. Well, so many people didn't realize, you heard the gentleman in the video, that the Victim Compensation Fund and the health program were for non-first responders. So they never registered in time, and they were therefore barred when they did find out about it. The special master has extended that deadline. Thanks to John Stewart, we got the full extension of the health program and the Victim Compensation Fund till 2090. And the special master gave everybody who missed that 2-year strict deadline till next July 29th to register a claim. So Lee mentioned earlier, if you're in touch with any widows, widowers, family members, ask them, did you register your family is entitled to financial security. This is a slide of Dr. Luft over at Stony Brook, who's in the World Trade Center Health Program, talking about all the people with 9/11 illnesses who are particularly at risk to the coronavirus. Our law firm has already lost over 100 of our clients, and all of them with underlying conditions such as COPD or interstitial lung disease, or chemotherapy had ravaged their immune system. They just couldn't fight it. So this is a wake-up message to everybody. Please take care of yourself. Wear a mask, especially this holiday season. Don't go out if you don't have to. Just please be careful. Next slide. James, would you please take us through the benefits of the World Trade Center Health Program, why those who haven't already joined should consider doing so?
Absolutely. So the World Trade Center Health Program is a great resource. It's so important, like we were saying, early detection is the best medicine. But what's also fantastic is to be screened specifically for 9/11 related illnesses. And that's what the doctors at the World Trade Center Health Program do. You get your annual checkup, again, where they're looking for specific illnesses caused by exposure, your traditional pulmonary illnesses like COPD, asthma, chronic bronchitis is very common. And of course, unfortunately, your more severe conditions like emphysema, interstitial lung disease, and of course, lung cancer. And what's great about the health program is once they certify that your illness is in fact 9/11 related, which the law presumes, they will then cover the cost of treatment and medication for that condition for the rest of your life. Your insurance will still pay the amount they're billed as they normally would, but the copays that you would normally be responsible for will be picked up by the World Trade Center Health Program.
We have the World Trade Center Health Program on one side, and we have the Victim Compensation Fund on the other side. Both programs have been extended to outlive us all. Both programs have been extended until 2090. The biggest reason why our firm pushed so much last year to get this bill funded and fully authorized was because we know it takes time for many of these cancers and respiratory conditions to develop. So, many of my clients right now are getting diagnosed with lung cancer, with different types of skin cancer, with different pulmonary conditions. And 5 years ago, they were perfectly healthy. We don't want people starting this process when they're sick. We want them starting it when they're healthy, when they can get the proof of presence documentation together, get their medicals together, and join these programs. But the benefits of the Victim Compensation Fund are unbelievable for first responders and survivors, people who worked, who lived in the zone, who went through the zone every day. But there are non-economic loss awards for pain and suffering. And as you can see here, for non-life-threatening illnesses, such as, let's say, asthma, sleep apnea, to me, asthma is life-threatening to me, but it ranges on severity. So the awards can range from 20 to 90,000. Skin cancers can range from 90,000 to 250,000, and life-threatening cancers, you will get an award from 200 to 340,000. Now, let's say you got an award for asthma in 2015, and then God forbid you get diagnosed with lung cancer in 2022. We can amend your claim for an increased award. Just because you accept your initial claim does not mean you can't go back with change in circumstance. Just like we can make an economic loss claim for loss of earnings. I have many of my Goldman Sachs clients, my firefighters, my sanitation employees, that their cancers cause them to be disabled from the workforce. And the Victim Compensation Fund allows us to make a loss of earnings claim to make people whole again. That is something that the Victim Compensation Fund does amazingly. They know 9/11 exposure, and they know what you're going through on a daily basis. Just like James stated before with the World Trade Center Health Program covering medical costs, if you weren't in the health program, if you got diagnosed with prostate cancer in 2009 and joined the health program in 2014, and you paid a lot of out-of-pocket medical expenses relating to your cancer and chemo treatment, then we can make that claim directly to the VCF to get that reimbursed back to you. The health program will cover all future costs, but they will not retroactively make you whole, but the Victim Compensation Fund will.
Don Penson and Dana Cohen.
When somebody passes away from a 9/11 condition, their family can bring a claim. And if the person who passed away, the decedent, never filed a claim while they were alive, their family can file a claim and recover for the categories of damages that the decedent could have brought during his or her lifetime. In addition to that, the family is entitled to all kinds of death benefits. Again, there's an additional award for the decedent's pain and suffering. The surviving dependents of the decedent are themselves entitled to direct awards for what the VCF calls non-economic loss. In addition to that, the family is eligible to recover for lost earnings that the decedent would have gone on to earn had the decedent not passed away. Also, the family is entitled to recover a category of damages that the VCF calls replacement services. That's an award to compensate the dependents of the decedent for the services that they lost around the house, outside the house, from their loved one that the loved one used to perform for them. Burial expenses, funeral expenses are also recoupable. We present paid funeral bills to the VCF and they compensate for that. And Dana is going to talk to you now about what we can do today to make those claims more successful.
Thank you, Don. So one of the things we've learned doing this work is that more than a third of the families who find their way to us come to us more than 2 years after they've lost their loved one to 9/11 disease. It's because most people in the 9/11 community don't even know that they're entitled to the VCF. Their family members are one step removed from that. And so we are trying so hard to get the word out because we know that July 29th, 2021 deadline is coming. And we know we're going to get a call on July 30th because we get a call every day from a family who's lost someone, and they will be too late. And then, what will we be able to do for them if they've missed the deadline? So you have to talk to your family. That's the most important piece of advice I can give you. Make sure that they understand that you are part of the 9/11 community. Make sure they understand that there's a presumption. Make sure that they understand that a doctor does not have to link the death to a 9/11 illness. If you were there and you meet the exposure requirements and you pass away from one of these diseases, they will have a claim. For anyone to receive benefits and for any family to receive benefits, the VCF has to be convinced that you meet the exposure requirements, that you were there. And the best way to do that is by getting affidavits from people who saw you there. Ideally, you will have two. Ideally, these won't be family members, and these will be people who saw you. As time is marching on, that's getting harder and harder to do. And if it's hard for the people who were there to find their witnesses, well, it's going to be even harder for family members to track down the people who saw you there. So you have to get those affidavits now. The other thing that all of us in the 9/11 community can do for our families, and this is so important, is get a will. A will is important because the person who's entitled to bring the 9/11 claim is the representative of your estate. You can choose who that person is if you have a will. If you don't have a will, it'll be whoever is first in line according to the law, and that will be the person who will serve. You will have a say in where some part of that award goes, where some part of the wrongful death award goes. So, and you do that through your will. If you don't have a will, the part of the award that passes through your estate is going to go by the laws of intestacy. It's a formula that the government developed, and it's generally not what most people want. It's not what's best for most families. It's a formula. So, you want to make sure that's in place because you and your family know what's best. And you should have a lawyer look at those affidavits because the VCF is a bit strict about the affidavits, and they'll deny a claim if the affidavit doesn't meet all of their requirements. I see on this slide, it says to update your beneficiaries. Please do that. It happens all too often that there's an unhappy situation where somebody just never got around to updating their beneficiaries. they have a spouse, but you know, the beneficiary is an old girlfriend, and it happens. And we have seen it happen. So take care of that.
We have some time for some questions. Hillary, would you please go ahead and ask us a few questions?
WTC Health Program acknowledges pulmonary sarcoid in the first responders. Has there been any headway re cardiac sarcoid?
But the answer is that inevitably patients with cardiac sarcoid can be identified as having some manifestation of pulmonary sarcoid. Almost everyone with sarcoidosis will have some evidence of pulmonary involvement. If you did a biopsy of a lymph node in the chest or did a lung biopsy in a patient with cardiac sarcoid, you will find the classic granulomas in the lung. They can have the primary clinical manifestation in the heart, but almost always is concomitant with some evidence of disease in the lung itself.
Wow.
You know, what's unique about World Trade Center exposure in sarcoid is that we don't know in non-World Trade Center sarcoid what causes it. It is one of the few things that we know a direct link between an exposure and the development of sarcoidosis. So it's really fascinating to us.
All right, thank you. Hillary?
Is COPD with nocturnal hypoxia requiring oxygen at night compensable?
Well, patients who have nocturnal hypoxia, meaning that when they sleep at nighttime, their oxygen levels drop and they require supplemental oxygen, which means they drop below typically about 88% in order for CMS to reimburse you for that oxygen. That's pretty significant COPD. And so you heard before, there are two types of COPD, regular COPD and COPD with exacerbations. This would be severe COPD. I defer to you guys in terms of whether it's compensable, but it's pretty significant COPD to drop your oxygen levels in that.
And Lee talked earlier, I'm sorry, Lee talked earlier about the fact that they give different varying amounts for COPD. This sounds like one of the serious ones that would get you the most amount of compensation, and I hope you never have it.
My spouse has stage 4 lung cancer, and I don't think he'll make it to next year. What should we do?
I hate to hear that. And the truth is, it's something that we hear all the time, unfortunately, because these 9/11 cancers are so aggressive. They're like cancer on steroids. So one of the great things about the VCF is it actually allows us to expedite claims for claimants who are diagnosed with stage 4 cancer. So instead of them waiting typically over a year and a half to get an award, the expedite process really only takes a matter of weeks. So if this is the case, it sounds like time is of the essence. I do hope you call an attorney because we have experience expediting these claims. And again, expediting, you don't lose anything. It doesn't cost you anything. You get the same award that you normally would. You just get it significantly sooner.
How long does the process take?
Lee, you get asked this question every day. Go ahead.
Every day. So it all depends. Just like Dana was saying before, if you get your affidavits and proof of presence together now, before you get sick, it'll take a lot faster than if you start this process and you're looking for presence documentation. Joining the World Trade Center Health Program while you're healthy rather than when you're sick makes it go faster too, because we don't want you starting this process when you get that, oh my God moment. So as long as you get that documentation together, the claim can go by much smoother. If you have to wait in line to get certified by the World Trade Center Health Program, if you have to wait for all your presence documents, it takes time. It's not like a regular lawsuit where someone slips and falls at J. Crew or the Gap, and these lawsuits can take 3 to 5 years. The fund can turn around claims very fast as long as we have everything together and documentation there.
In general, Lee, would you say that I know special master
6 months, 8 months, a year and a half, 2 years, depending. If you're filing an economic loss claim, wrongful death cases do take longer periods of time as well. So it all depends on everyone's individual situation, but that's kind of the range that these cases can take. And as James said before, God forbid you are in a terminal nature, and also the VCF has a financial expedite process as well. We could turn a claim around in a few weeks.
And Dom, if someone dies intestate, which means without a will, how long is it likely to take for a surrogate court to appoint an executor? And that's assuming there's no fighting in the family. How long can that take?
The appointment of a representative for an estate, again, it depends which county you're in New York State, and if you're out of state, it's different still. That's relatively quick. That can happen in a matter of a few weeks, the appointment of a representative. What takes a little longer is at the back end of the process, if it's necessary to go back to court to get permission to distribute the award, which sometimes is the case. And again, it depends on the county and it depends on, but that can take a period of weeks in some places to months in others.
So the moral of the story is do a will. I know we sound like a broken record here.
Can I file for both workers' comp and the World Trade Center Fund?
Yeah, of course you can. As Lee said earlier, the two aren't mutually exclusive. As a matter of fact, the workers' comp board may find you disabled, in which case we can use that determination, just like a Social Security disability determination, to argue for lost income on your behalf. I want to thank everybody. I promised that this wouldn't go over an hour. Dr. Sturman, I can't thank you enough for your time. I know it's the end of a long day for you, but you were wonderful. And if we have any follow-up questions, we'll send them to you, and then we'll pass them along, the answers along to the people who've asked them, okay?
Sure.
Good night, everybody. Have a happy Thanksgiving, and mostly stay safe out there.
Wear a mask.
Wear a mask.
Yes.
Good night.